Happy first day of fall. I'm Pam McClouchich, Executive Director and founder of the Davies Project. Thank you for joining me this morning. My favorite autumn tradition as a child was jumping in giant leaf piles. My kids loved going to the apple orchard and making fresh apple strudel. A health crisis harshly interrupts traditions. We've seen that with the current pandemic. Feelings of isolation, loss, and stages of grief are common, which may leave us feeling extra stressed, anxious, and irritable. For families that have a child with a serious health condition, the global pandemic compounds those feelings. When my oldest child, Peter, was 3 years old, we went to New England to celebrate the holidays. On Christmas Eve, Peter spiked a fever of 105 that was impossible to lower with any kind of medication. We cooled him as best we could in the bathtub, cuddled with him to calm him down, yet grew increasingly frightened as he sobbed with what turned out to be bone pain during the night. As quickly as we could, we returned to Michigan, where Dr. Susan Burke diagnosed his symptoms quickly and accurately. We learned afterwards that most doctors would have told us Peter's condition was likely viral and to wait it out, by which time the cancer could have spread to his spinal column. In retrospect, we were very lucky. Regardless, by now, 95% of Peter's blood consisted of cancerous blasts. At the time of Peter's diagnosis, my husband and I also had a 21-month-old son named Will. I was also 6 weeks away from delivering our third child, a daughter named Maria. No matter what life throws our way, I am certain that we will never feel as stressed or out of control as we did then. For example, on the day I went into labor with Maria, my son was in need of a blood transfusion. Imagine going into labor in one bed with your son receiving blood in the bed next to you. It was a helpless time for all of us, although Sparrow Hospital was wonderful. They took great care of both Peter and me, keeping us together as best they could. Afterwards, we spent almost every day of my daughter's first year in the hospital with Peter as an inpatient or outpatient. While Maria was always in my arms, I don't have many memories of her first in those 12 months. Fortunately, 2 years after Peter's treatments ended, my husband and I had a fourth child, Claudia. The six of us celebrated all of her firsts together. For 3.5 years, Peter received regular doses of chemotherapy and intrathecal injections into his spinal column. On several occasions, we feared we would lose him. For example, one time in particular, Peter's vital signs bottomed out during a spinal tap. He later described being on the ceiling, looking down at himself and at us. He was frightened because we didn't see him in the uppermost corner of the room, even though he was trying to jump down into our arms. Peter said he felt as if he was being pulled away from us, as though caught in a river. Fortunately, our story has had a happy ending. Peter is 24 now, with Anya, the girl of his dreams, and working on a PhD in mechanical engineering. As a result of everything we went through and what I saw other families go through, I resolved to do what I could to help other families and children with serious health conditions have happy endings. As part of this resolution, I worked for a few years with Dr. Deli Davies, who was at MSU and was a tireless advocate for children's health. He's now at the University of Nebraska. This organization was named to honor his vision for coordinated care for children in Lansing. The Davies Project offers help to hundreds of families with children who have serious health needs, but we're so much more than just a ride. Our dedicated team of volunteer drivers provide rides to medical appointments, a connection to community, and the possibility of hope for families. Wouldn't it be wonderful if all children could reach their potential? That's what we're working towards. No child misses an appointment, and all children become as healthy as their doctors can make them. While our volunteers provide rides to more and more children every year, we are still only reaching a small percentage of the children who need help accessing health care. The pandemic is exacerbating these numbers. Children who are healthy do better in school and are better poised to achieve their potential. Parents who aren't stressed about losing their jobs due to a child's illness are more productive at their jobs and more financially secure. Likewise, families are more successful at staying together when children are healthier and stress is less of a factor. 80% of pediatric care takes place in the outpatient setting. About 75% of Lansing's population lives in South Lansing, while on average it takes about 10 minutes to travel from South Lansing to Sparrow by car. By bus, it involves at least one transfer and some walking and can take 1 to 2 hours. To the MSU Clinical Center, a 15-minute car ride from South Lansing takes 60 to 90 minutes by bus. Imagine doing this with a sick child, an additional toddler or two, diaper bags, medical equipment, and bad weather. Now imagine doing this multiple times a week, or in some cases, a day. And think about having to do this while trying to hold down a job or jobs to avoid an interruption in income or health care benefits. Lack of transportation significantly affects access to health care and disproportionately affects those on the low end of the socioeconomic spectrum. About 70% of the children who use the Lansing area specialty clinics are on Medicaid and miss roughly 60% of their medical appointments. Volunteer drivers from the Davies Project make it possible for families who need transportation to access health care. Doing so helps the future of our community's children and the well-being of the families that are raising them. The effects of missing appointments are many. If sick children miss their medical appointments, they will not get better. Children who are sick miss lots of school and instruction. Sick children with little education and training are more likely to become adults who cannot find even a low-paying job. This affects the community as a whole. When families are forced to take time off from work to care for a sick child, they are not earning money. This affects their financial situation, including their ability to save, spend, and invest. Nationally, in 2019, the average out-of-pocket cost for treating pediatric cancer was $35,000. Imagine the impact of this on a family that is already struggling. Knowing this, it shouldn't be surprising that parents of special needs children have higher rates of anxiety and depression, which negatively impact their ability to stay employed. Medical providers lose money when patients do not show up for their appointments. One local major health provider estimates it loses at least $250,000 in revenue annually due to patient no-shows. Getting children to their appointments saves healthcare providers money. These are the many reasons why we are asking you to invest in the Davies Project. Please go to www.thedaviesproject.org and click on the yellow Donate Now button. Be a partner in driving change today. Together, let's help our children be healthy, reach their potential, and enjoy family traditions regardless of the season.